Hi, my name is Shannon. I'll be your nurse today.
Hi, Shannon.
Hi, what seems to be the problem?
Okay, well, my wrist has been really bothering me lately.
Okay.
This hurts a lot.
Alright, and when did this begin?
About like a week ago, I fell on it, and it's just been bothering me ever since.
Okay. And does anything that you do to your wrist make this pain worse or anything?
A lot of times when I twist it, or when, I lift heavy things with my arm,
Okay.
it's really bad pain.
Alright. And what kind of pain is this?
It's really sharp pain.
Alright.
It's like really shooting pain in my wrist.
Does it just stay in your wrist, or does it go up your arm?
It's just in my wrist, really, kind of looking at it.
Alright, great. And if you could rate this pain on a scale of 1 to 10, 10 being the worst, what would you rate it?
When it is painful, it's like a 7 or 8.
Okay. And then does this pain come and go, or does it stay for a while?
Just really when I, make it worse, when I aggravate it.
I agree. And what do you think is wrong with it?
Well, I did fall, so I think that, I don't know what I did. I probably must have broken it, maybe.
Okay, let's see. Alright, so I'm going to check out the symmetry of your wrist first, so just to see if everything seems to be lined up. Okay. Alright, so that seems, your wrist seems to have good symmetry. Now let me just see the other wrist, so I can compare the two sizes. Okay, so it's your right wrist that you hurt, and it seems to be a little bit bigger than the other wrist. It's most likely from swelling, so it doesn't seem like the bones are any bigger or anything. The contour of your wrist, there doesn't seem to be any abnormal bumps or lumps, which is good, and the range of motion. So do you think you can maybe bend it up a little bit, and then down, and then around each side?
That kind of hurts now.
Yeah, and then maybe around. If you can't do it, don't try to strain it.
Yeah.
Okay. And then, so the skin tissue of the joint, seems like maybe you had a little brush from when you fell on it, right? But it doesn't look like it was too bad of a scrape, so that's good. The color of it doesn't seem red at all. The color seems normal, but there is a little bit of swelling that I can see. And there's no big masses or deformities of it. It just seems like it's a little bit swollen. Okay, so now I'm going to palpate your joint, and I'm going to check first for the temperature. So let me just compare to the other wrist to see if your right wrist is a little bit warmer than your left. But they seem to be the exact same temperature pretty much. I'm going to check your muscle strength, so maybe do you think you can make a fist for me? Okay, good. And your muscle seems like there's no tears or anything like that, and you seem to have the strength to be able to make it. Do you think maybe if you put it down, you can try to push it up against resistance? Okay, so your muscle strength seems okay, just a little bit sore. Okay, so your wrist seems okay. I mean, it seems to probably a sprain or something because you were able to move it in a different direction. But now I'm going to check your different joints. So I'm going to start with your temporomandibular joint. So if you open and close your mouth. Okay, I'm checking for clicking. You don't seem to have any bad clicking. Now I'm going to check your neck. So if you could just stand up with me. So now if you can look up to the sky and now down. If you could look both sides, and put your ear to each shoulder, and then all around. Okay, good. And then I'm going to ask you to turn your head against my hand. So look to the right. Look to the right. Alright, good. Now your shoulders. So I'm going to ask you to put your hands back, and then up, around, and now abduct, and now abduct. Okay, good. Now put your hands to your side and invert your shoulders in, and then invert your shoulders back. Alright, good. Great. Now for your elbows, if you put your elbows out, and then flex, and then extend. Alright, great. Let me also check your shoulders, see if they're nice and even. They seem to have even symmetry. Good. Your elbows we checked, and now wrists and hands. So if you turn back around, if you can hold your fingers out, and then make a fist. And now we did this before. You can go easy on your wrist that hurts. I just want to check your other one as well. So it's up, down, to the side, around, and then invert and evert. Good, that seems great. Okay, so now I'm going to check your hip. So if you can lay down on this table here. All right. Great. And now if you could lift your leg up. All right, like this side. And now, first, lift it straight up. All right, great. Now, make a butterfly with it. Good. And now move it to the side. And now if you move it in. Good, great. Okay, so now if you check your knees, you can sit up. And you can kick out. And then kick back. And then the other one, kick out. And then back. Great. And now ankle and foot. So if you can point your foot down, and then back up, and then invert it in, good, and then the other side out, great, and then do it with your other foot, up, down, invert in, and then expert out, very good. Oh, and then finally your spine, so if you stand up, alright, so I checked your shoulders, make sure they were equal, so I'm going to ask you to put your hands at your sides, and touch your toes, and I'm going to check your spine to see if it's aligned. So I'm running my fingers down your spine. Okay. Good, that seems to be perfect. And now for the balance test, I'm going to ask you to put your hands in this position. Alright, great, you can do that perfectly. Alright, so thank you very much, and I think you just have a sprained wrist, so maybe put some ice on that and alternate ice and heat, and you should be great.
All right, thank you.
Nice to meet you.
Nice to meet you too.